Systemness.
Hey, we're live.
Okay.
Okay. Hi, everybody. Welcome back. Sorry, we had to wait for our legislative council. Working on one of our bills and ways and means. Glad to hear it. So we are
Madam Chair? Yeah, I have to correct the record.
Oh, yes.
That's we talked about. Thank you.
Yes.
Apparently I misspoke yesterday. I was told that when we were talking about on the team two testimony that a social worker left the Westminster Barracks because of the tragedy there. And that in fact was not true, that she had already had that transfer in motion. So I just want to be sure that that record is clear. Thank you.
Thanks, Leslie. Appreciate it. All right, so we're moving on to H558 and we're going to do a walkthrough with Jen on it.
Good afternoon, Jen Kirby from the Office of Legislative Counsel. I will put this language up on the screen. So we are looking at H558. And this is an act relating to the Medicaid School-Based Services Program. And so at a high level, this is really transferring sole authority over school-based service Medicaid services from being split between the Agency of Human Services and Agency of Education to being just in the Agency of Human Services. And there's some additional provisions as well. So an act relating to the Medicaid School-Based Services Program starts out by adding a new section in Title 33 in the chapter on Medicaid. That it would be entitled the Medicaid School-Based Services Program. And it starts there with expressing legislative intent that the state maximize its receipt of federal reimbursement for medically related services provided to students who are eligible under Title 19 Medicaid of the Social Security Act. And it is also legislative intent that Vermont's school-based medical assistance program shall comply with all federal Medicaid requirements. And as the state Medicaid agency, the Agency of Human Services shall have sole responsibility for determining and maintaining program compliance. Then it gives the role of the Agency of Education, which will be responsible for coordination of the school-based medical assistance program with statewide education policy and objectives, and for communicating with supervisory unions, and may specify the use of program funds received by state education agencies in accordance with 16 VSA 2959A, which I believe you'll see coming up in the bill. It directs the Agency of Human Services to adopt rules to identify the services that are available through the school-based medical assistance program and set forth the requirements for supervisory union participation. And the rules would include state and federal requirements for Medicaid reimbursements, Medicaid cost reports, provider enrollment and trainings, service documentation, Medicaid eligibility, and any other provisions needed for compliance with the Medicaid program. And it directs the Agency of Human Services to support supervisory unions by funding and providing the technical elements of the program necessary for federal compliance. Section 2 adds a new section creating the school-based Medicaid reimbursement fund. This would be in the statutes right after the section we just looked at. And this would establish a special fund to receive federal reimbursements for medically related services delivered pursuant to the Medicaid School-Based Services Program described in the previous section. And money received by the state under this section would go into the fund, which would be administered by the Agency of Human Services, and fund receipts shall be allocated in accordance with this section. Directs the Department of Vermont Health Access to pay 55% of the federal reimbursement monies generated by the medically related services delivered in each supervisory union under the Medicaid School-Based Services Program to the supervisory union. So 55% of the federal reimbursement from those medical services or medically related services would go to the supervisory union based on the Medicaid cost reports, service claims, and Medicaid administrative costs submitted by the supervisory union. Up to 25% of the federal reimbursement monies generated by those services will be available for the administrative costs of the Agency of Education and the Agency of Human Services related to collecting, operating, and reporting school-based medical assistance programs and statewide programs. Requires the agencies to enter into a memorandum of understanding, an MOU, that sets forth the processes by which Medicaid reimbursement monies available for administrative costs and statewide programs are allocated to each of the agencies, and requires the Secretaries of Education and of Human Services to expend monies from the fund only as appropriated by the General Assembly. At the close of each fiscal year, the Commissioner of Finance and Management is directed to transfer and deposit any balance remaining in the school-based Medicaid reimbursement fund into the education fund. Section 3 amends 16 VSA 2959A. That was the section referred to in Section 1. It's a provision in Title 16, the education title, currently entitled Education Medicaid Receipts. We changed that to Medicaid School-Based Services Program, Supervisory Unions, and Supervisory Districts. It starts out with some similar language to what we saw at the beginning of Section 1, expressing legislative intent that the state maximize its receipt of federal reimbursement for medically related services provided to students who are eligible under Title 19 of the Social Security Act. So it's really modifying to parallel those sections and expressing further intent that each supervisory union, as you can see, some of this is current law, whatever's not underlined, each supervisory union identify special education and other students who are eligible for Medicaid reimbursement, and to the extent possible, submit, and changes the language from Medicaid bills for services reimbursement to Medicaid compliant cost reports and service claims. I'm sure you'll hear more from AHS about why these language changes are necessary. And then keeps language directing the agencies to work with local school districts to maximize reimbursements, including services to non-IEP students. Then most of the language on the special fund was moved and modified in Section 2. So all of that language and some of the specifics under it, which you can see, I think it was 55%. And the new language, 50% here, goes to the supervisory union. So some modifications and some changes from specific dollar amounts and amounts in excess of minimum thresholds. So the special fund language has changed fairly significantly. And then this directs the supervisory unions to use the funds that they receive from the special fund to pay for the reasonable costs of administering and delivering medically related services pursuant to the Medicaid School-Based Services Program, and then keeps language allowing school districts and supervisory unions to use the funds received under this section for prevention and intervention programs in pre-K through grade 12, and then delete some additional language about the programs. And then this has the Agency of Education adopting rules setting forth the requirements that supervisory unions and school districts must meet regarding the use of Medicaid reimbursements from the special fund, coordinating reimbursement related to state-placed students under Section 2950 of this chapter in the education statutes with the Medicaid School-Based Services Program as set forth in what is now Sections 1 and 2 of the bill. And these rules must address the manner in which supervisory unions receive and reconcile funds in alignment with education cost reimbursements under 16 VSA 2950. And the act would take effect on July 1st of this year. So again, big picture is moving really all for Medicaid purposes, all of the Medicaid administration to the Agency of Human Services, but keeping some responsibilities for both AHS and AOE.
Any questions on the language for Jen? Go ahead, Leslie.
I just want to be sure I'm understanding this. So in section B or section 2, subsection B, it's 55% to the SU.
Yes,
And then in C, up to 25%.
yes.
What about the rest?
You'll have to ask the agencies what the plan is for the rest. Anything that
Will be
remains,
included in the bill or?
anything that is unspent would go into the education fund at the end of the year. But this language was provided to me, so I will encourage you to ask.
Yes, go
The
ahead.
record don't language with fiscal, I would defer that to when Ashley speaks. She's gonna talk about how it's currently done and why it changed. And so she will answer that.
Okay, great.
Great.
I have one more question, if I may. In C3, it says they shall expend monies for the fund only as appropriated by the General Assembly through the budget process. Is that what that means?
Yes, or through any, like, I mean, through any
It could be the
legislation.
year-round kind of thing also if we're not in session. How does that?
I don't know what the year-round thing is.
Let's ask Ashley.
Okay.
Yes, but in general, I
Thinking
mean,
about JF, the emergency or, whatever committees do that when we're not here.
yeah, they should not be appropriating funds with the exception of some certain allocations authorized by the emergency board, but appropriation is, yes, appropriation is a legislative function. And whether it happens in the budget bill, which is the standard these days, but has not always been, or in some other legislation.
Thank you.
Thank you, Chair. Yes. Lauren?
For the record, Ashley Berliner, I'm the Director of Medicaid Policy for the Agency of Human Services. It's good to be here in 3D today.
Okay.
I am gonna share my slides. How do I do that? Oh my gosh, I'm so sorry. It's not like I've been sitting here for 45 minutes where I could have prepared.
Or we usually have Alex in and she runs the slides.
I just think the links back, so you can just join it and then share your screen.
Thanks, Tasha. I would talk while I'm doing this, but I've
That's
learned that I
okay.
can't. I'm incapable of doing anything else when I'm joining Zoom.
Just to reallocate.
This is.
Like make sense of this.
Ashley's make sense now.
I think that you do that.
It's getting closer. I don't know why that slide's blank though. It's animation I didn't know about. Okay, can you see that?
Yeah.
All right.
Is that the title you want?
What?
Are we talking about electronic health records?
Nope, that's not the right title.
Okay, thank you. I was like,
Sorry. The rest of this is very custom though. Okay, so for the agenda today, I definitely want to put in plain language what Ledge Council just walked through. So we'll go through that in detail. Before I do that, I really want to talk about why we're putting that in statute, why we're looking for this change. And I'm going to start with just what are Medicaid school-based services. Medicaid school-based services are services provided to Medicaid kids in the school setting. So they're Medicaid services that you can get anywhere else, but they're unique because they're provided in schools. And the federal government has made exceptions to how those services can be delivered, paid for, and generally provided when they're in the school setting. So qualifications for providers can be different, documentation needs are different, what the services actually are from like a medical necessity process can be different. So they're a unique category of Medicaid services. So for about the last year and a half, the Agency of Human Services and the Agency of Education have been working really closely together to reform Medicaid school-based services, how we're doing it today, and migrating it into a new system of care. We have a goal of migrating this program by October 1st, 2026, so coming up really soon here. And that reform effort that we want to hit 10/1/26 aims to solve numerous existing programmatic issues in the current state and also encourage school participation through administrative efficiencies. We really have 4 pillars for what's guiding this reform effort, and that is ensuring federal compliance, expanding access to Medicaid covered school-based services, reducing the administrative burden on schools and the state, and maximizing the federal reimbursement. It references here a CMS grant, and that is because we have a federal grant to help us do this, to actually modernize the program. CMS issued new guidance for school-based services in 2023 that allows states to bill and think about school-based services in a more flexible way. And so this effort really allows us to take advantage of that new guidance and modernize our system. The current system is broken. It is not something that we feel like we want to get in and tweak around the edges. We are really looking to overhaul the system in its entirety. And that includes these 3 legs of the stool, these 3 buckets here. The first is changing the program administration, moving program from AOE to AHS, establishing a new payment methodology, moving to a random moment time study, and having clear clinical level data. And we're doing that through an electronic health record. So what is in that statute that Jen so eloquently read to us? To put it in plain language, it does a few things. For the Agency of Human Services, it establishes a special fund so that AHS can receive and reimburse the federal dollars that schools are delivering for the Medicaid services that schools are delivering. It establishes AHS/DIVA as the administrator of school-based services. And AHS/DIVA here is an important thing to point out. DIVA is the payer. They are going to be the ones who are functionally administering this program from a business office perspective, but policy sits at AHS. And so it will be a joint endeavor between AHS and DIVA. The proposed statute provides rulemaking authority for AHS to establish requirements for school-based services. And in that, we specifically want to require schools to use the random moment time study for billing of school-based services and to use the electronic health record to ensure that we have compliant clinical level data for Medicaid services. And then on the AHS side, it requires AHS to support schools by funding those things. So we're going to be funding the RMTS. We're not asking schools to pay for that. And we're going to be funding and standing up and providing technical assistance for the electronic health record. We are not asking schools to pay for that.
Can you talk a little bit about RMTS?
I can talk a little bit about it.
That's all I need.
RMTS is a random moment in time study, and it is a payment methodology. It allows us to create a statistically significant percentage allocation of the amount of time that certain eligible school-based providers are spending providing Medicaid eligible services to Medicaid eligible kids. So it actually generates a number that allows us to say 25% of these people's time can be billed to the Medicaid program. From a school perspective, it's a really light touch. We do this now. DCF has it for their family services division caseworkers. We do it in corrections for probation and parole. Random moment time studies are a really ubiquitous way to kind of get that allocation across funding streams. For schools, what will be required of them is once a quarter, a small sample of providers will get basically a prompt to say, go into the system and tell us exactly what you did during this moment on this day. And there's a pretty short time frame to go in and enter that data. So because we don't want people to have to remember back weeks ago. And they say, you know, I was providing physical therapy to a Medicaid eligible kid. I don't even think they have to say Medicaid eligible. I just think they say providing physical therapy. And then we collect those moments in time. We match that up with the cost allocation plan that schools submit and the Medicaid eligibility that schools have, school districts, supervisory unions. And that generates a percentage where we get to bill Medicaid for X percentage of their time, their costs. I'm sure that isn't a perfect explanation of it, but
That's great.
you can definitely have someone come in who is a real expert on that if you need more information.
No.
That's the gist. So that's the AHS side of the house in terms of that statutory proposal. For AOE, it authorizes the Agency of Education to define how schools may use the federal payments from AHS for Medicaid services delivered. And AOE is going to come talk about that and use the term reinvestment dollars. So just want to clarify here that that's what this is. And it also grants AOE rulemaking authority to set requirements for how schools are allowed to spend reinvestment dollars paid by AHS. So I'm going to get to the slide here and have a little bit of a better idea of how those percentages play in. So the proposal really aims to simplify how this is broken down in statute. The current state says that 50% of federal revenue can be paid back to the school in the form of reinvestment dollars. Up to 30% is used for state administration. Anything that's not used up to that 30% gets put to the ed fund, in addition to another 20% to the ed fund. And then there's this very convoluted language around an incentive fund that we are asking to be stricken. It is not used today. It's a mechanism for providing additional payments for schools if certain threshold amounts are exceeded. It is not in use and just overly complicates the federal or the funding picture. The top half of that current state is for direct services, and that's what you think of when you think about kids getting services at schools. That is a part of the school-based services that's currently administered by AOE. Below that, health access and outreach, that is our Medicaid administrative claiming program. And that is it's a subset of school-based services. It's administered by the Department of Health. And it is what we think of as health outreach and access. It is helping get interpreter services for medical appointments. It is helping get medical appointments, making sure that the kid has access to vaccinations and has a PCP. It's really those like administrative functions, and that is happening through the health department right now. That breakdown in how federal funding participation is 85% to the schools and 15% to state admin. In the future state, we are combining direct services and health access and outreach. They will no longer be two separate services, two separate programs administered by two separate entities. Everything will be combined. Everything will be using that random moment time study, and it'll all be administered at AHS/DEVA. So the changes to the numbers in statute that you see that the reinvestment dollars are increasing from 50% to 55%. The state administration max is decreasing from 30% to 25%. And the ed fund is remaining the same, 20% plus unspent admin funds. The investment fund is going away because, again, it's not used and it's just really overly complicated. So those are the kind of changes and percentage that you're seeing and that Jen walked through in that statute.
Does this include SB6 services?
It does not. Great question. So Success Beyond 6 services are excluded from this. This is limited today to the services that schools are are delivering in-house and their school nurses doing access and outreach.
Can you speak to how Success Beyond Six gets billed then? How is it? Well, maybe not. Sorry.
Wasn't prepared.
Sorry, I asked. No.
Success Beyond Six is administered through the Department of Mental Health, and it is services that the school contracts with the designated agencies to provide. And it really is a separate mental health component. That we're thinking about how that will fit in, and so that we can leverage some of the flexibilities that we're gonna take advantage of here, how we'll be able to leverage that for Success Beyond Six in the future. But that's like phase two,
Okay.
where as you can imagine, this is a huge lift. And so we're really just trying to keep it narrow, not include Success Beyond Six. And then hopefully we can take advantage of some lessons learned and bring them to Success Beyond Six in the future.
Thank you.
Well, essentially, the bill is just making things uncomplicated, or it's a step in the process that we're going through right now to redo this.
Yes, it's a necessary step to give us spending authority to make sure that we can administer it at AHS. And it also streamlines the payback of the federal funds a little bit.
You remember me sending you that email from CMS in 2023 about this? I do.
Maybe about the new
Yeah,
guidance,
and about
yeah.
the grant
Yeah.
that they were offering, and I was like, are we really maximizing in
Yeah.
the way that we do this? And you did it, and
And here I am.
here you are on the way, but just thank you for everything that you do with Medicaid for us. You're just
It's been such a
Wonderful.
massive effort, and like so thankful to the Agency of Education for the really, really close collaboration. We've been working on this for almost 2 years now. So it's a really massive team effort for sure.
Great. Thank you, Ashley.
I'm just trying,
Oh, go
I'm
ahead.
just trying to add up the numbers on the right. I'm sorry, I had to get out my calculator because it's pathetic, but so it's 55 plus 25, and that equals 80.
Mhm.
And then you add the 20, and then you're 100. So what about the unspent admin? So I'm just trying to understand how that fits together.
Yeah, so today, if you look at current state on the ed fund, the statute says you can spend up to 30% on admin. That's not happening. AOE is not spending 30% of this. So anything that they're not spending is going to the ed fund. That's that unspent percentage. And that's the same in the future state too. The statute has really like placeholder language of up to 25%. We don't anticipate it costing up to 25%. So it just defaults to
So for
anything,
each of those levels, there's going to be perhaps unspent, and that'll go to the ed fund.
not for schools. Schools locked in at 55%. That's not going to be
So
on.
that's not going to change, but the stated admin and the ed fund might vary.
Yes.
Got it. Thank you.
Yes, and sorry.
No, I was gonna say, good time to mention that reminder that we're like doing the policy, and I am making 100% guaranteed guess that our clerk of the house will send this to Ways and Means.
Yeah.
Who probably will spend a great deal of time looking at that piece of it.
I just want to understand it. I'm sorry.
It's actually prompted me to say something that I should have said at the beginning, which as we played with these numbers a little bit, we were really intent on holding everything harmless. So making sure that we didn't take any more money out of the ed fund, making sure that the admin pieces continued to be covered. So that was all thought through when we changed those percentages. And when we were looking at it, we were like, we can give the schools an extra 5%. Like we have that. So that's how that shook out.
Thank you.
You also mentioned that you're suggesting language. Did you say that you're suggesting language?
I sent you language a while ago, but now it's going into the big bill, so I'm not exactly sure. Did you not know that?
Okay.
I've been working with Rapotin on that
Yes.
piece, and I think I even saw it in the big bill, Jen. So yeah, let's coordinate and make sure that's in there.
Yeah, Rep. Houghton had given me a heads up that there was maybe a small change that you wanted to make, so I assumed that. So we'll figure that out.
Perfect.
Can I ask another?
Yes.
In 3, I was just curious to understand, it just says shall expend the money for only appropriated by the General Assembly in the big bill? Or is,
Yeah, I think that's the intent of
That's it.
that language.
Okay,
It's
that's
when
clarity.
AOE and AHS come with their budgets,
that's
the
where.
legislature will appropriate money.
Okay,
Yeah.
so that does not need to be stated. Thank you.
Thanks, Ashley.
Thank you.
Thank you much.
And we have Jill, you want to come on up? Or were any of you?
The whole team.
We're gonna do the
whole team.
Okay,
yes.
then let's have the whole team.
Yeah, we'll take a minute to get some chairs.
Exciting, we never did the agency of
I was gonna
education.
say, this is, I mean, I'm in this building a lot, and I was like, where is House Help? I found y'all, you got there. I'm gonna sit to the side, because you're mainly gonna be hearing from Kate, sorry, Kate. So we'll do.
If you want.
So for the record, I'm Jill Briggs Campbell. I'm the Deputy Secretary of Education and Chief of Operations. And I'm joined today by Katie and Sutter from our team finance. I will let them introduce themselves. I'll do just very brief kind of opening remarks, but you're mainly going to hear from Katie, but we're all available to answer some questions should you have them. So Katie, if you want to introduce yourself?
Yeah, for the record, I'm Katie Smith. I'm the Education Medicaid Director, the Agency of Education.
Great. For the record, I'm Sandra Ryan, the Chief Financial Officer of the Agency of Education. So my very brief opening remarks, you've already heard from Ashley. So what you have in front of you in terms of this language is the result of a really collaborative process that's been going on for almost 2 years. A real recognition of kind of a realignment of roles and responsibilities in ways that will best serve our schools and also streamline administration. And really, as I like to think of it, having kind of the right expertise in the right locations. So the role of the Agency of Education in this space is sort of three things. One is ensuring that, ensuring that the Agency of Education has very tight partnerships, as you might imagine, with our school districts. So helping to build those kind of collaborative relationships with our partners at AHS, kind of our communication lines, identifying key stakeholders and implementation partners. So really leveraging those relationships and helping to elevate any potential barriers or obstacles, or hey, you might want to be thinking about this. So just being kind of thought partners in that way. The second is we're really laser focused on, as you know, our education system, just like our healthcare system, is under a lot of pressure and change right now. So really ensuring that this piece of work and this transformation, we're just bearing in mind sort of the bigger picture, and ensuring that we're trying to line up timelines as best we can. They're not matching as much as we would like, but that's okay. That almost never works out perfectly. But just really keeping that bigger picture in mind. And then during the transition, really focused on maintaining operational continuity and minimizing disruption in the field. So that's sort of our main areas of focus and how we are supporting this work. And so I think our presentation is brief because you've gotten really the big overview from Ashley, but you may have some specific questions for us, and I'll kick it over to Katie.
All right, thank you. All right, so this is an overview just of what you've already seen. This is after the claims have been processed and paid, there's the 50, 30, 20 split of the federal dollars. So what are the functional updates that are needed to Title 16 to elevate the program? Our goal overall is to design a responsive system that increases direct support to schools, provides insight to the health outcomes that impact academic success. That 55% reimbursement, that is what is reinvested back into the schools in prevention and intervention programs, and those are to serve all students. I guess I should also add too, the removal of the obsolete requirements here. Those were mechanisms designed to encourage participation, but since we're moving away from the claims-based model, they're no longer needed.
Right. So I'll talk a little bit about the agency's priorities right now through this implementation phase. So of course, as Jill mentioned, our top priority is to coordinate between agencies to make sure that our districts continue to receive consistent and clear communications, leveraging those relationships that we have and those communication methods, right? We've got some established lists that we use, and making sure to always kind of connect it back to that education policy. We are going to support the transition, worried about continuity of operations. When I say worried, I just mean we're going to watch it, right? We're going to be very watchful to make sure that during the transition, that the school districts remain unharmed through that, making sure that everything continues. There will be a period of time where two systems are operating at the same time, right? Like, or not at the same time, but two systems operating in one fiscal year. So there's that period between July 1st and, as Ashley mentioned, that 10/1 implementation date of the new system. We will have to maintain status quo. So that will be on us. We will be supporting AHS's communication plans and then really focusing on strengthening that reinvestment process. That's where we get to that 55% that is going to be going to the school districts. But we're calling that the reinvestment process. That will require us to make rules, and we're very aware that timely rulemaking will be something we'll really need to keep our eye on. It's a pretty quick timeline. So we'll be focusing on that and really making sure that we're prioritizing the use of data as we inform that rulemaking process.
So the main takeaway here is that we really want to be intentional with planning and the best use of the funds. With the state level funding, we want to be the example. We want to review how we're spending our 25% share. We're going to prioritize statewide interventions and establish that memorandum of understanding. And then on the other side, our goal is to guide the LEAs, which are the school districts, to be intentional as well. We want to give them parameters for fund use and reporting through rulemaking, establishing planning processes, and aligning the spending with the goals that they already have, which are in their continuous improvement plans. Hard to do everything. Yeah, so we're just trying to get to the heart of outcomes reporting. The rulemaking is really going to help help the LEAs navigate a clear process and clear expectations, building on the success of what's working well already. We want to design a reinvestment process on the strengths of both the MAC, which is the health access and outreach process, as well as our current school-based health services processes. We also want to create a unified data set for Vermont Department of Health and us AOE to use. And just to close, we want to make these funds and processes to make sure the program supports students in a meaningful way.
And I would say sort of our current state in some ways is Katie and Katie's team is focusing on the administration of the program, right? And so we've identified, just as we are across the Agency of Education and kind of all things right now, where we can make some improvements. And so what you heard from Katie is really the focus on how that 55% is being used effectively in our schools, right? And we, as we diagnose with most things in the education system, there's wide variety and variability in the quality of those reinvestment plans. Right now, we really have sort of a back-end reporting function, kind of, did you do it, right? And we're really looking to sort of shift our focus and support to how are you doing it? How does it actually align with your larger continuous improvement plan? What are you identifying as student needs, and how are you leveraging these funds? So we're really trying to shift districts to thinking about, here's our needs, here's our plan, what funds are available to fund that plan, rather than letting sort of the fund drive the work. So I think that we're pretty excited about this. We think that we can really do a lot of good work in this space, and we're kind of all about elevating the quality of what's happening in our system. So as I said, this is really aligning our expertise to the right place, and then aligning the expertise of DIVA and AHS to the right place in ways that I think will actually benefit the whole system.
Any questions for anyone? Yeah, go ahead. Sorry.
On your slide, and I see that you're close to your computer, but on slide 4, so the overlap of the two systems is really going to be 2 months? Is it just from July to October?
Yes.
Okay, so, well, July, August, September, 4 months.
And then is that including the closeout? Or that will happen after the final
So there's a
closeout?
claims runout period.
Yeah,
So the services will be provided up, that will be paid for under our model, the current model, up until the last day of September. And then so from that last day of service, they have 6 months to get the claims in. And so we'll be providing support through that time.
As someone who's been intimate with electronic health record conversion, it's torture. So thinking about the random time study, how do you integrate using your that data collection through the random time study while you're making this conversion?
So we're being really thoughtful with AHS, and I think that they are leading that plan.
Okay.
I'm can't believe I'm in this position, but I'm wondering, is there anybody else we need to hear from? Do we need to hear anything else on this? I mean, this seems like you have been working for a couple of years on developing a better process. That process has been developed and you need language from us to implement appropriately. Do I need to hear from anybody else? Do you have suggestions on if we need to hear from anybody else?
I wouldn't mind an answer from AHS on my question, if that's a future question or not. Not just the thought about it.
Can you remind me of
The EHS conversion, they have 4 months of overlap. How that is going to impact providers at the school level?
It sounds like the implementation plan for the EHR.
Yeah,
Is that-
and how that's going to affect, that's hard. And I just don't want people to get, when are you doing your time study? Random RMTS, new to me. So how does that all fit in?
And it's important to us that they don't have duplicative work as well.
I'm sorry?
It's important to us that they don't have duplicative work.
Yeah, I'm sure. Yeah, you all seem very.
I want to try, I'm not trying to punt, I'm actually trying to point it
No,
to,
no,
yeah, the
correct
team that's
person.
leading it, so yeah.
Yeah, go ahead,
Yeah,
please.
why don't you, here, why don't we swatch?
Sorry.
So the RMTS and the electronic health record are not integrated. So those are not connected situations. One is a statistical measure and one is an electronic health record. Today, what's happening is schools are documenting all of their clinical data on paper. So we are aware that this is a significant change for the schools in Vermont. We have staffed this unlike anything I've ever seen. I've been in Vermont Medicaid for a long time, and the amount of resources we have to make sure that this is successful are really impressive, I think. We have a vendor working on change management and doing all these communications with us and focus groups and really working closely to make sure that we know what schools need. We have a technical assistance vendor that's working really closely to understand the business needs of schools. We're going to also have a business assistance vendor that is working hand in hand with schools to make sure that they are registering users correctly, that they're getting their data in correctly, that all of those like annoying kinks of getting into an EHR for the first time are being carefully held by a professional. So we really are thinking about this in the most thoughtful way. The last thing we want to do is make it harder for school providers. That is really the antithesis of this entire work. And we know that it's going to be a lift and a sprint getting to October, but we think it is worth the effort and is going to just really improve things once we get that behind us.
Can I ask another question? When do you think your first time study might be?
We're implementing the time. Oh, and let me also say, thank you. These are really helpful to prompt new information to share with you. So the RMTS, the Random Moment Time Study, is being implemented statewide on 10/1. That is a change in payment methodology, and that change in payment methodology is happening across the state all at once. The electronic health record is going to be implemented over a phased period of time. So we're really looking at school calendar year 26-27 to get that rolled out to all the districts. we're gonna start with a small group of like high achiever volunteer districts is our plan right now to really not pilot, but like start out the EHR, make sure that we're hitting our marks. And then we're gonna roll it out to different supervisory unions from there. So we are not standing up the electronic health record statewide all at once. I think that would be too big of an ask and it wouldn't allow us to iterate in the way that we think we need to. And are really gonna phase it in.
That's great. One more, just curiosity. When you do your first studies over that first year, will working in the electronic record be one of the choices of where you are in your time, or is that not?
Oh, I don't know. That's a great question. I can look into that. I think that, I don't know.
Yeah. Well,
I presume,
Maybe-
I presume it's like anything related to delivering the service, but we can
yeah.
find out.
Okay, well, thank you. Thanks for coming in.
I'd like to give you some easy ones.
I'm appreciate it. Okay.
Thank
So. I think that unless anyone has anything further, I think I'll work with Tasha and possibly put this on our schedule for next week for markup and the school vote. Sounds good. Yes.
You asked if there was anyone else that we should speak to. This is gonna be uninterrupted change over to the providers themselves. Do we need to hear from the providers? In schools?
Let's ask Ashley that.
Okay.
And I think it sort of plays into the question that Leslie had asked.
Okay.
Sort of. So if we need further clarification, we'll get that and then we'll decide. So next week sometime. All right. We can go